Good day, everyone. We are Group Doctors.
And we are going to present on how to treat a burn and electrical injury. First-degree burns are very common. Unlike second or third-degree burns, first-degree burns only involve the top layer of the skin. People often get this burn after accidentally touching a hot curling iron, hair straightener, or stove. Sunburn can also be a first-degree burn. If you have a first-degree burn, your skin may be red, painful, and have mild swelling.
Treat a first-degree minor burn. Follow these tips from dermatologists. Immerse the burn in cool tap water or apply cool wet compresses. Do this for about 10 minutes or until the pain subsides.
You can apply a moisturizer or aloe vera gel to the burn area to keep the area moisturized and to minimize inflammation as the burn heals.
Do not apply toothpaste or butter to the burn, as these may cause an infection.
Drink extra water when you are sunburned to help you prevent dehydration. Same as the first-degree burn, second-degree burn can also be treated at home, but visit urgent care if serious enough. The only difference between the first-degree burn and the second-degree burn is that you have to clean and cover the burn.
Do not pop the blisters. Consider taking over-the-counter pain medication. Acetaminophen or ibuprofen can help relieve the pain and reduce inflammation.
Third-degree burns destroy the epidermis and dermis. Third-degree burns may also damage the underlying bones, muscles, and tendons. There is no sensation in the area since the nerve endings are destroyed. After cleaning a burn site, you can apply antibiotic ointment and an anesthetic cream, and then you can cover the burn with gauze or bandage.
Adult electrical injury usually occur in occupational setting, whereas children are primarily injured in the household setting. How to treat major electrical burns? First, do not touch the person if he or she is still in contact with the electrical current. Do not move the person unless necessary. Once the person is no longer in contact with electrical current, try not to move him or her unless completely necessary. Check to see if the person responds. The victim may unconscious or otherwise unresponsive to touch or when spoken to. If the person is not breathing, perform rescue breathing and CPR. Call for immediate medical assistance. Electrical burns can have an effect on the electrical activity of the heart. Call 911 or another emergency response number, especially if the person is unresponsive or if the burn is from a high voltage wire. Treat the burn areas while waiting for medical assistance to arrive. Cover the burns with a dry, sterile gauze bandage. For severe burns, do not attempt to remove pieces of clothing that have stuck on the skin. Check the victim for symptoms of shock. He may be cold, have clammy skin, a pale appearance, and or a rapid pulse. Track any of these symptoms to tell the emergency responders when they arrive. And keep the victim warm. Try to prevent the injured person from becoming chilled, which can worsen the shock symptom. If using a blanket, keep it off the affected area while waiting for paramedics to arrive.
Follow all doctor's order. Depending on the severity of the shock and the burn, the ER doctor and nursing team will have a wide variety of possible tests and treatment options. It is likely the collecting of the blood and urine test and the ECG. Follow prescribed treatment. The doctor is likely to prescribe medication for pain management as burn can be painful while healing. You will likely receive the prescription for antibiotic creams or ointment as well to apply as directed when changing bandage on the affected area. Watch for signs of infection. The prescribed treatment will likely include antibiotics in order to keep the burns from becoming infected. However, you should still watch for the signs of infection and see your doctor immediately if you believe the wound has gotten infected. Change the bandage often. Anytime the bandage becomes wet or soiled, change them. Clean the burn using clean or gloved hand with water and a mild soap. Apply more antibiotic ointment and re-rub with a new, sterile piece of non-stick gauze. Discuss surgical option with your doctor for severe burns. For severe third-degree burns, doctor may recommend a number of surgical options depending upon the size and location of the burn. And lastly, discuss physical therapy option if necessary. Potential muscle and joint damage associated with severe burns can lead to decreased function. By seeing a physical therapist, you can build strength in the affected areas, increasing mobility and decreasing pain associated with certain movements.